Hi, my name is Brad Siff. I'm the founder of Biowave. We're going to talk about Biowave pens. It's a percutaneous electrical nerve stimulation system. Biowave pens is comprised of a Biowave Pro stimulator and Biowave percutaneous electrodes. The percutaneous electrode is a microneedle patch technology. There's over 1,000 needles. And it's they're sterile. It's a stainless steel needle. They're 0.75 millimeters in length. When this is placed on the body, the needles are pressed through the skin, and they provide a direct conductive pathway through the skin into deeper tissue. Forms in a 3 to 3.5 inch diameter hemisphere beneath each electrode. That active electrical field encompasses the nerve fibers, the pain fibers, C fibers, the A delta fibers, the sensory fibers, and inhibits action potential propagation on the pain fibers and induces hyposthesia in this volume of tissue. The result clinically is typically up to 72 hours of continued pain relief. Typically about 7 or 8 patients out of 10 respond to this treatment. The average response is about a 75% reduction in pain in the group that responds to these treatments. The typical treatment regimen is 6 treatments over a 2 to 3 week period. We empirically see that there's a cumulative effect with multiple treatments over time. The device, the Biowave Pro stimulator, is very simple to use. There is no programming. The signals which emanate from the device are optimized for passing through skin into deep tissue. The body creates the active electrical field in this hemisphere beneath each electrode. The patient controls their own comfort level. So the only thing controlled on the device is the intensity, and the patient adjusts the intensity with the plus or minus button. So it's very simple to use. We're going to do a treatment now on this patient, and we're going to first ask the patient to identify where his pain presents. Can you please tell us?
Right around here.
Okay.
This
So,
area?
So we want you to point to the center. I'd like you to palpate and let's find the center of where the pain presents. So if you can press with your finger.
Here?
Mm-hmm.
Can you move
Right.
the... Okay. And this area?
Mm-hmm.
Okay, so mark the center of the spot, and then he was also pointing up further on his neck. Okay.
Okay.
So those will be the center of the placement of the location of the 2 electrodes. Next, we have to clean the skin with an alcohol prep. Much like you would in the way if you were giving an injection to a patient. You clean each location with the alcohol prep, and then you want to clean the other location as well.
Yes, sir.
And we have to let the alcohol dry. We do not want to place an electrode over wet alcohol. The electrodes cannot touch. There's a minimum of about 1 inch of spacing between the electrodes. Each electrode package is sterile, single use. The electrodes are placed in Sharp's disposal following the treatment. The cup on the back of the electrode is peeled around the perimeter, and you try and peel it gently so we do not kink the metal array that's on the electrode. The electrode is centered over the center of those painful locations where the 2 marks were placed. So we're going to place that down. Just touch the hydrogel perimeter gel around, and now you're going to take your 2 thumbs together, centered over the middle, and press very firmly to press all the microneedles through the skin. And then you can go 3 o'clock, 6 o'clock, 9 o'clock, and then 12 o'clock, and we're really ensuring that all the microneedles are through. That way we're bypassing the impedance of the skin. Okay, now we need to do the same for the second electrode. Very good. So the setup, as you can see, only takes about 3-4 minutes to identify where the pain presents, clean the skin, place the electrodes, and now hooking up the electrodes to the device is very simple. The metal cable has a red dot, and this has to face up, and the notch mates with a keyhole at 12 o'clock, and that clicks in place. The blue connectors, either one can be attached to either electrode. The orientation of the blue connector doesn't matter. It can be placed this way or this way. The orientation doesn't matter. Either one can be plugged into either one. And they just click in place. They purposely stick out this far so you have something to grab onto to pull them apart following the treatment. The power button is on the side of the device. You hold it down until the screen lights up. When the screen lights up, you let go of the button, and the screen should read 0.0%. If it reads 0.0, the patient is ready to begin the treatment. The patient starts the treatment by pressing the plus button. As soon as you hit it, it goes up in 0.5% increments, and the countdown timer starts counting down. So we will give this to the patient to control, and the patient can now control their own comfort level by adjusting the intensity with the plus button on the face of the device. So the patient should take it up so the sensation they feel is as strong as possible but still comfortable. The body will adapt to the electrical field very quickly in the first 2, 3, 4, 5 minutes of treatment. As the body adapts to the electrical field and the sensation diminishes, the patient should continue to press the plus button to make the sensation as strong as possible but still comfortable. The typical treatment level we want the patient to get up to is a minimum of about 17%, and by the end of the 30 minutes, most patients fall between 20 and 30% intensity. Some patients may be a little bit more, some a little bit less, but that's a typical active, good intensity level for a treatment range. The treatment may feel like a strong pins and needles initially. The body creates hyposthesia in the volumes of tissue beneath each of the two electrodes. As that hyposthesia develops, it takes about 5 minutes for the hyposthesia to kick in. That helps mask some of the strong pins and needles initial sensation that the patient feels, and the treatment gets even more comfortable, and so it allows the patient to continue to advance the intensity to higher levels during the treatment. At the end of the treatment, the hyposthesia may last anywhere from 15 to 20 minutes, so it'll feel like a light numbness sensation following the treatment. Once that wears off, the majority of patients have significant pain relief that can last up to 72 hours following the treatment.
My name is Dr. Santi. I'm an internist from Central Florida. I have a diversified medical clinic where I treat all kinds of medical conditions. One of the most conditions that I treat is chronic and acute pain. I have been using Biowave for the last several months with very, very good results. I have the conditions that I use it for vary from neck issues, back issues, acute pain, chronic pain, fasciitis, all kind of musculoskeletal issues that this is used for. My experience with this has been that the majority of my patients on every treatment have received significant improvement in their pain, increased mobility, and range of motion. In this particular case, my patient has had neck issues for quite some time, and with most of it reflecting in his trapezius and rhomboid muscles. As you see, this is where we're treating today. I have an assistant that helps me to place this, and I choose to check in on my patients. However, that is not absolutely necessary for each time. My experience has been that each visit the patient has had approximately 20-25% improvement in their symptoms. When we reach the certain percentage on the machine, We record it, so the next visit, which is usually a couple of days later, we restart at that point or a couple of points lower, so that we try to maximize the intensity over the 6-period treatment. But the conditions, as I said, include cervical, lumbar, and chronic musculoskeletal issues. I have had good long-term results with my patients at this point, talking for about a 6-month experience. The effect seems to be cumulative on these patients. When they get to the end of the 6 treatments, they tend to have some good long-term relief from it. I've had great results on patients from all conditions, including post-op pain, especially if they've had previous neck or back surgery. We try to treat our patients conservatively in our clinic using the least amount of controlled substances. This has been an excellent modality for me. I have also had excellent reimbursement from the multiple insurance carriers.
At the end of the treatment, the display indicates the maximum intensity reached. This should be noted in the patient treatment form. Now you can disconnect the device from the patient. You can press the power button to turn the device off, hold it down until the screen goes dark. This cable is removed by grasping the metal barrel with 2 fingers and pulling straight back, and that retracts the little black catches on the side of the connector. These blue connectors can be, you just pull them straight apart with 2 hands and they come right apart. To remove the percutaneous electrodes, you peel them gently off the skin. There will be a pink circle the size of the ray, and you can see the dimple pattern of where the needles penetrated the skin. In some cases, there will be a few drops of blood in where those microneedles are. This pink circle typically resolves in 24 to 48 hours. If a patient has very sensitive skin, it may take up to 24 to 48 hours to resolve, and that's normal. There's no dressing or anything that has to be done. If there are a few drops of blood, you can take sterile gauze to clean the location. The electrodes are single-use disposable. They're placed together like this, so the needles are covered, and then this gets placed in Sharps disposal following the treatment. We have 2 different size sets of percutaneous electrodes for focusing the signals to different parts of the body. In one set we call the B set. There are 2 percutaneous electrodes. This set, the B set, B really stands for back or bilateral pain, but the 2 percutaneous electrodes allow us to treat 2 distinct volumes of tissue. So when these electrodes are placed on the skin, we're capturing a 3.5-inch diameter hemisphere, half of a sphere beneath each of these 2 electrodes. So if a patient, for example, has bilateral lumbar pain, we can place 1 electrode 2 inches to the right of the spine, a second electrode 2 inches to the left of the spine, and capture the volumes of tissue beneath each of these percutaneous electrodes. The B set can also be used to treat radiculopathies. Let's say the patient has pain in the buttock and it radiates down the sciatic nerve. So 1 electrode can be placed directly over the buttock where the pain first presents, the most proximal position. The second electrode can be placed over the source or origin of the pain. If it's a herniated disc at L5, this electrode would be placed directly over L5, and we're capturing both the source or origin of the pain as well as where the pain first presents. So that's another way that the B set can be used. The third way the B set can be used is to treat large areas of pain. If these 2 electrodes are 1 inch apart, whether they're placed this way or vertical placement like this, essentially we're capturing a 6-inch by 3-inch volume of tissue, because the hemispheres that are going to overlap internally, and we're just capturing a large area of tissue. So those are the 3 ways that the B set can be used. The E set, E stands for extremity pain, but it's essentially comprised of 1 percutaneous electrode and one non-invasive electrode. So the advantage of doing this is by having a percutaneous electrode with a non-invasive electrode, we have an impedance difference. The impedance is virtually zero at the interface between this electrode and the skin, and it's much, much higher under the surface electrode. So the sensation felt by the patient is much greater under the percutaneous electrode. So the percutaneous electrode is placed over a single point of pain. That's what this set is used for, to treat single points of pain. The non-invasive electrode is a much softer, more comfortable sensation that the patient feels underneath it, and it typically is placed directly over a bony prominence, because a bony prominence in particular is a very comfortable place to receive the Biowave stimulation. So for example, if we were treating, can I use you as a model? So if you could turn around with your back to the camera. If we were treating a trigger point in the thoracic area of the back, and say this was the center of where the pain presents, we would place the percutaneous electrode right over the center of the pain. The bony prominence comfortable location for this electrode would be the front corner, gets placed just posterior to the AC joint on the top of the shoulder, and this electrode is run at an angle along the spine of scapula. This is a very comfortable place to take stimulation. The patient is only limited in how high they can advance the intensity by what they can tolerate under the percutaneous electrode here. Because this electrode is so comfortable, the patient is never limited in how high they can go up by what they feel under the larger non-invasive, the rectangular non-invasive electrode. They're only limited by the percutaneous electrode. And so we have a quick reference guide for Biowave PENS treatments, and this is what we use as our teaching tool when a new customer is set up. And in this guide we show the B-set percutaneous electrodes, the E-set percutaneous electrode, and then we have 40 photos for all the different parts of the body that we can treat, ranging from lumbar to the thoracic, cervical, and extremities as well. And this is kind of the cheat sheet to allow the healthcare providers to come up the learning curve very quickly, and makes this a very easy to use treatment modality. Contraindications for Biowave PENS include electrically implanted devices, so you cannot use Biowave PENS if a patient has an implanted pacemaker or cardiac defibrillator. If they have an implanted spinal cord stimulator or peripheral nerve stimulator and the device can be remotely turned off, then Biowave PENS can be used. Electrodes you cannot use Biowave PENS on patients prone to seizure, like epileptics. You cannot place a percutaneous electrode directly over the heart on the anterior of the chest. You cannot place electrodes on the front or side of the neck or on top of the head. Electrodes can be placed directly on the back of the neck right up to the base of the skull. Any type of internal metal hardware, from total joints to pins, screws, plates, and clips, is totally fine. Those patients can use Biowave PENS. Skin electrodes cannot be placed on broken skin, on rashy skin, over wounds. Skin should be intact. An electrode can be placed right up next to an incision on a postoperative patient. Once that incision is healed, an electrode can be placed, a percutaneous electrode can be placed over scar tissue. It can be placed over tattoos. If a patient has jewelry on, the jewelry should be removed if it's anywhere near the vicinity of where the electrodes are going to be placed. Please read the user manual for all of the detailed information on the use and operation of the device.